My name is Kaylee Dowell, and this is my final project for ES 4050. I completed my practicum at the Wellness Center working in the Thrive program. This is Becky, the nurse on staff, talking a little bit about why she likes the Thrive program so much.
Okay. Hi, I'm Becky. I'm the nurse for the Thrive program at the Wellness Center, and I help people who have chronic diseases like diabetes, lung disease, cancer, or heart disease, and I help them learn how to eat right and exercise and deal with their medical conditions and improve their quality of life. And I like Thrive because I love to help people. It's very rewarding to see people start getting more strength and endurance and feeling better and see their overall quality of life improve.
The first thing that is completed when a participant comes in for the day is the check-in. The participant will have their heart rate and oxygen saturation checked, their blood pressure checked, and some patients will have their blood glucose checked. Here, I am taking the blood pressure of one of the participants. No one can begin their workout before the nurse on staff is present and all of their vitals have been checked. This is one of the most important parts of the Thrive program. The participant will be closely monitored throughout the workout, but pre-vital signs are crucial to the well-being of the participant throughout the workout. Some of the diabetic patients will have to eat a snack before beginning their workout if their blood glucose is too low, and some patients with low blood pressure may have to drink a sports drink. This ensures that the participants will have a safe workout. Here I am setting up one of the participants on telemetry. This is a portable pack they wear throughout their workout so their heart rate and rhythm can be continuously monitored. There are 3 leads that are placed on the body, one below the clavicle on the left side, one on the lower left side, and another on the lower right side. Before placing the leads, I have to make sure the area it will be placed on is clean, so I use an alcohol pad and some gauze to clean and dry the area. After the leads are placed, I turn the device on and select the number on the monitor that matches up with their pack and select their name. Telemetry is used mainly on cardiac patients, but all participants must wear the pack for the first 3 times they come to Thrive, just to monitor them very closely. Here is one of the participants working on the new step, and I'm going to check on her halfway through the workout. I like to ask the participant how hard they are working while I place the pulse oximeter on their finger. While I'm waiting on the reading, I look at their RPMs, steps per minute, or whatever the exertion level for the machine they are on is presenting. I then record the information on their chart so that the exercise prescription for the next day can be determined based on their RPE, heart rate, and meds.
Tell me what you like about Thrive.
What do you like about this place? I like everything.
You like everything?
Yeah.
Anything in particular?
No,
No?
everything.
Everything? You like coming to work out
Yeah,
and making sure everybody's checking on
Yeah.
you? Yeah?
yeah.
Good. All right, well now I'm going to take your heart rate.
I don't have a heart.
You don't have a heart. Well, how hard are you working?
About 5.
5, okay.
I came to Thrive because I was diagnosed with systemic lymphoma in June, and they told us about it at our initial appointment, but I was so, energy-wise, everything was just, I was just very sick and didn't know it. Anyway, went through my first treatment and was kind of in the house and thought, I'm going to get depressed, and I thought, I can't do this. And so we said, we want to check into Thrive. So started it in August, and it's been wonderful. Got my energy totally back. I mean, pretty much, you know.
Yeah.
And I like how y'all really check on us, you know, to make sure we're doing whatever we're doing. And it's just worked for me.
Okay. I've been very privileged to enroll in Thrive, a program which offers pretty much anything a person needs, whether he is handicapped or whether he isn't or she isn't. Wonderful way to exercise, to strengthen the core, as well as to be aware of calories, protein, because there is a health coach and there is a nutrition coach. There are nurses and interns who take blood pressure as well as heart rate. So I am very thankful for the program and very thankful for the interns. We really hate to see them leave us. So I'm glad I am in Thrive.
Yay!
So what I like about Thrive is it's really a total approach to making someone well. You're working on getting them stronger, you're working on talking to them about cleaning up their diet. They have access to a nurse, exercise specialist, health coaches. You're really catering to the whole person, and you have a whole support team to do that. So there's so many avenues to help people, and it just gets me fired up. I love it. I love it.
Throughout my time here at Thrive, I've seen great improvements in many of our participants. I've seen some patients that have been relying on blood pressure medicine to keep their blood pressure down, going completely off their medication. I've seen participants that could barely make it 5 minutes on the treadmill, bump it up to 10, and also increase their grade. I've seen patients that require oxygen on most equipment reduce that down to only the elliptical and treadmill. I've seen great improvements in many of the patients' fat-free mass and fat mass percentages through BIA assessments. I have really loved working with this group of people, and I didn't think that I was going to particularly enjoy the older adults as much as I have. But they all have such a great story to tell, and they're also willing to come and work, and they love seeing improvements. Through this program, they will all be able to live an overall better life. A program like Thrive is such a vital component of the healthcare field, and I've experienced it firsthand this semester. I think that more healthcare providers need to think about moving towards exercise as medicine instead of moving straight towards prescription drugs when someone has certain diseases like hypertension or diabetes. I think that it's a great way to improve without medication. There's a wide variety of participants that we have in the Thrive program that range from diabetic patients to patients with cardiac disease, lung disease, and cancer. Not only is there clinical Thrive, but there's also Thrive for the community. These participants are just people that want a little bit of extra help when it comes to weight loss or weight management. I think it is really important that we start looking at exercise as a form of therapy and realizing that it has physical benefits, mental benefits, and also emotional benefits for all of these patients. Some of these people, getting out of bed used to be a struggle, but now they're getting out of bed, getting here and working out, and having even more energy for the rest of the day. Another thing that ranges with these participants is their age. We have had some younger participants who are in their 30s, and we have some of our older participants who are in their 90s. They all have a story to tell, and they're all here for different reasons, but they're all very willing and excited to be on a track towards wellness, and that's what I love about it. Overall, my experience at Thrive has been very positive. I learned so much from the staff and other interns. I learned how to be proactive and to be a good member of the healthcare field, and how to step up to the plate as an intern. I learned how to perform all the tests that I have been learning about in exercise science classes on real patients. I have learned how to professionally talk to someone about weight management and how to stay positive and push through the hard times. I am so glad that I have been able to work with this program and see all the participants improve.